is the deadliest enemy of liver, causing several complications. Alcohol-associated liver disease is one of the most common and devastating complications of excessive alcohol use. This condition represents a wide spectrum ranging from the relatively benign hepatic steatosis to cirrhosis and even hepatocellular carcinoma. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I'm going to discuss about whether patients with an alcohol use disorder who receive medical addiction therapy are less likely to develop the alcohol-associated liver disease. A recent cohort study investigated patients with alcohol use disorder, those who received a medical addiction therapy, and found that they had a significantly lower risk of developing the alcohol-associated liver disease, whereas patients with cirrhosis who received medical addiction therapy had a significantly lower incidence of hepatic decompensation. Findings were published in JAMA Open Network. They suggested that an association between the use of medical addiction therapy for alcohol use disorder and decreased incidence and progression of alcohol-associated liver disease. The medical addiction therapy was defined as the documented use of disulfiram, acamprosate, naltrexone, gabapentin, topiramate, or even baclofen. Patients were considered to be treated if they initiated the medical addiction therapy before the relevant outcome. The incidence of this disease was 0.37. This association was evident in naltrexone as 0.67, gabapentin as 0.36, topiramate 0.47, and baclofen at 0.57. In addition, pharmacotherapy for alcohol use disorder was associated with a lower incidence of hepatic decompensation in patients with cirrhosis, including naltrexone or even gabapentin. This association persisted even when medical addiction therapy was initiated only after the diagnosis of cirrhosis. The researchers concluded that results of the study showed that receipt of medical addiction therapy for the alcohol use disorder conditions was associated with a reduced incidence and progression of alcohol-associated liver disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.